Hello, everyone. Welcome to this week's episode of To The Point podcast. I'm Rachel Lyon, here with my co-host, John Knepher. Hi, John.
Hi, Rachel.
Hi. So what are you doing this weekend? You have any fun plans? Anything going on in San Diego?
Let's see, this weekend we're packing the kids up to go off to college in another couple of weeks. So,
Ooh, big
yep.
one.
Yep.
Big one. That'll be fun. Oddly enough, I am not cool at all, but I got invited to a fashion show. So, yes.
That sounds like a lot more fun.
I don't know. I think it'll be really awkward for me because I am not fashion forward. I wear black tops, black pants, and there we go. We're good to go. So anyway, without further ado, though, I would love to jump into this week's guest. Please welcome to the podcast, Russell Teague. He is CISO at Fortified Health Security. He's more than 3 decades in the information security world, spanning sectors such as healthcare, pharma, financial services, technology, among many others. And he's contributed his expertise to the White House National Cybersecurity Healthcare Strategy, among many others as well. Welcome, Russell.
Thank you, Rachel, and John as well. Many of our colleagues are also sending their children off to college. Mine are a little bit older now, at 36, 29, and 25. So.
Oh, nice. Okay.
Yeah.
Are any of them living at home? We were talking about that earlier. That a lot of boomerangs after college.
My youngest did come back after college. He was a music major. Playing saxophone, and he did come back, but he's engaged, and soon will be moving out on his own again. So, yeah.
Nice.
Congratulations. Yeah.
That's wonderful.
At that point, we'll be empty nesters for the second time around. But we've got one beautiful 2-year-old granddaughter, just amazing, right? And so, because we had 3 boys, and we didn't have the young girl, and so my wife is over the moon, right? Just absolutely over the moon. Bank account's hurting from it, I'm sure.
Oh, that's fantastic. I would move back home, Russell. I'm just saying. I don't think you're ever too old to move back home. Putting that out there. So.
Well, it's just so difficult today's economics, right? I mean, price of even rental homes and everything else are just through the roof. So it's difficult for young adults in the early stage career. It's just challenging for them. So.
Yeah, it's when I lived in New York. Last little sidebar here. I lived in New York for about 15 years and worked at some agencies, and so there were always a lot of right out of school folks joining, and they would have like 5 or 6 roommates in a 1-bedroom apartment, and someone sleeping in the vestibule, someone sleeping in the bathroom, but that was the only way they could afford to live in New York City. It was bananas, and that's just crazy to me. I couldn't do that myself.
Yeah.
All right. John, do you want to kick us off and let's get to the real conversation?
Yeah, Russell, so let's just dig right in here. What are the top cybersecurity threats in healthcare today? What's most pressing?
Where do we start, right?
Right.
And so, but I think if I was to kind of pick maybe the top 3 to 5 here, ransomware and probably most specifically ransomware as a service, right? Because we're seeing more and more where sophisticated advanced persistent threat groups or hackers are creating ransomware as a service and enabling much less sophisticated organizations to go after it. And healthcare still has the largest data trove available, right? If you think about identity theft, and there's so many undocumented people here in the country. Identity theft is a major issue, and as well as targeting revenue cycles and payment redirections and things like that. That ties right into third-party, right? Third-party risk would kind of be my number 2 in terms of third-party compromise, because the threat actors see the opportunity to breach one entity but get access to many. So it's a one-to-many situation for them, because most of these third parties are interconnected with so many significant organizations. Change Healthcare and Move It is 2 great examples of where third-party risk is really starting to be on the rise in terms of the overall threats. AI, no conversation in cybersecurity can be had without AI nor healthcare. AI is everywhere. It's not a fad. Let's be clear, everyone. It's here to stay. It will change our lives and the way we operate, as many wonderful disruptive technologies do. But when I think about AI and AI threats, there's kind of three domains. One is the enablement part, and I'll speak from a healthcare perspective. The added advantages that the doctor gets, not only in just recordings, but also access to information to compile therapies and the efficacy of therapies. So, if you need services, you want the service that's going to give you 100% outcome, right? I want to know that my disease or whatever I'm dealing with can be solved. I don't want to try, well, maybe it sort of worked over here, and this doctor knows that, and it might worked over here. This doctor knows that one, but over in the Europe, they've got 100% efficacy, right? And so I want the one in Europe, right? I mean, so AI is giving access to all that information and bringing us better therapies that have better outcomes. So that's saving lives. Right. The other two kind of stools to the legs to the stool in terms of AI is the offensive and defensive side, right? Offensively, right? Threat actors are using it to be, better at what they do, right? And as well as even evolve those, right? We're seeing malware that self-evolves. Associated with AI intelligence. And then you see in my world, being a managed security service provider with Fortified Health Security, the defensive side, right? Ability to rapidly process massive amounts of data, draw conclusions, look for unique behavioral changes, both in system and network traffic. So AI is definitely there. And then I'll end with hack the human, right? It's still the most number one prevalent way that threat actors get access into our environments. Humans, by nature, we want to be helpful. We want to hold the door open. We want to, let me show you where that's at. And we like to click on the funny things, the morning news and things like that, and HR and people's payroll. And so it's still the most common way to get someone to either social engineer them or send them an email or browser link and get them to click, right? So end user training is essential.
And AI has been helping that aspect along quite handily. So thank you for that. So it's an incredibly broad landscape. And I think for something like healthcare, the stakes are incredibly high, Russell. We were talking about that a little bit before we started. I mean, we're talking lives are impacted and at stake. And, in all your work with clients, how do you, with a vast threat landscape like this with such high stakes, how do you counsel them? How do they prioritize, particularly when we know a lot of these organizations are just financially strapped, razor thin budgets, doing all they can to kind of shuffle things around to work day to day. I'd be curious, how do you even kind of go forward in that landscape?
One of the things that I think we advise our clients on the most is, think about the threats that are targeting your organization. Every organization has a unique set of threats based upon their size, their rural location, the communities they serve, how integrated with those communities they are. And so they all have a bit of different challenges, but most importantly, when you think about what you need to do, have foundational components right in your program to around operational resiliency, right, around sustainability. Cyber attacks are always going to be there, right? It's just part of what we do as cyber leaders, and healthcare is the number one targeted sector currently, and so. Operational resiliency, maintain patient care, the ability to deliver patient care, and build in mechanisms to do that. Right. Incident readiness, I think, is another really key item. Is train and be prepared to fight the fight. Right, old military term. Always trained to be ready, and so. So incident readiness, tabletop exercises, solid incident response plans, business continuity, disaster recovery plans are all critical elements to that. But you have to balance it. Have a balanced approach. Have both capability to have visibility into your environment so you know when things go awry or go different than what's expected. And then when you understand the business impact that it might have, control your blast radius, we like to call it, through network segmentation and limiting the blast radius or impact. And then vulnerabilities and exploitabilities, right? Know your vulnerabilities in your system. We all deal with legacy devices. So understand those vulnerabilities, but then understand which are actually being exploited in the wild and prioritize getting those fixed up front. Healthcare can't protect everything, right? At least not equally.
Right.
But with the right visibility, process, discipline, and a well-formulated response plan, we can prevent disruptive attacks from becoming, major crises.
So Russell, you kind of touched on a little bit of the disparity of the sizes of the healthcare organizations in what you were saying there. And, when we've talked to people in the past on the show here, right, there's always this, how do the smaller guys play and protect themselves? Here on healthcare, like, what does that look like? How do the smaller or say more rural or different healthcare organizations manage to do what's appropriate?
Right.
Yeah, John, you're 100% correct, right? I mean, there's about 1,900 rural and community hospitals throughout the U.S. Unfortunately, the state of their business affairs probably puts more than half either at or near bankruptcy. We're seeing large consolidation, right? Where mid-enterprise or full enterprise health organizations, health systems are buying up the small rural ones, spreading their market and their brand, which is great because they need the help. But the bottom line is the call it the fairness across the board is not the same, right? You've got rural facilities that are, 25 beds, 30 beds, but they're serving a critical need. This is where federal government's got to step in, right? They've got to bring assistance and capability. I know there's some challenges associated with the big beautiful bill from the current administration around Medicare, Medicaid funding and reimbursements. There's been multiple movements. Senator Cassidy, Senator Warner, many others on the Hill are working in the right direction to try to move legislation forward that leverages Medicare, Medicaid reimbursements, but gives you the benefit if you do comply, if you divert funds and do invest in cyber as a critical element, and you can achieve or demonstrate that. Well, then you get better reimbursement. So there's a bit of an incentive, and then there's going to be a bit of a stick, right? But that stick has to have a long enough run rate for people to actually achieve it, right? Healthcare in general, I feel, is running, at least in the rural space, could be running as much as 20 years behind, right? So they're missing some of the foundational elements I talked about, right? At Fortified, I advise my clients, right? The top 5 things I would focus on a robust healthcare cyber program: annual risk analysis, vulnerability threat management, right? Penetration testing annually, incident response readiness, and then have technology enablement through both EDR, endpoint detection and response, and your SIM, right? Log management, bring that together so you can have predictive and be proactive in your response. Those 5 things are critical. There's another 5 to round out the top 10, but I won't really go through those. But I think that's the element. There is a disparity between the enterprise ones that are well-funded, supporting major metropolitan cities, right, with lots of patients and lots of access. But some of these rural communities where, the average mean income is, well below $80,000, right? These services, a lot of time that they're filling their communities is not covering the cost to run the service. And so we need government subsidy to take care of that.
I know there are small business resources, for example, and I think rural healthcare facilities are in some ways small businesses as well. Is there, from your perspective, is there training or things that they can kind of do on their own? Because I suspect, like a small business, they have a IT guy who's covering a lot of ground in addition to cybersecurity. And are there kind of certifications or trainings or things that you might recommend for folks just to kind of arm themselves with a little more knowledge and capability?
Yeah, there are some great informational sites and access to services. CISA is a perfect example, right? That and they're part of obviously the HHS and CMS world, but they offer free services. They'll do free tabletops. They'll do some risk analysis. All organizations, I highly encourage them as part of their incident readiness plans to know who their local CISA rep is, engage with them in those services, right? They can help augment your cyber program at no cost. They offer those services free. You may have to wait a little bit to get in the queue and get scheduled, but there's also opportunity to participate in regional events, right, that they offer at no cost as well. And I've been part of and led a few of those as well. They're wonderful events because if you participate in one of those, you can have your team present, walk through the same exercise, and actually declare it as a tabletop, a virtual tabletop that you've done for your organization. You're just playing it on the national stage, where we do have some of those situations. But the cyber readiness divide requires the rural and community hospitals to do things differently, right? Because the funding's not there. HSCC, Health Sector Coordinating Council, it's headed up by Greg Garcia. Eric Decker used to be one of the leads, is now, but he's moved on. Still heavily part of the effort, but Greg Garcia has amassed a significant set of resources to really help training and educate the users. There's stuff on AI, there's stuff on cyber resiliency, vulnerability management, how to operate in down economic times. There's just so much information. I participate, I think there's 13 or 18 working groups that are going on every single week. I participate in a number of them, like the White House and many other, in terms of what is the right implementation plan for healthcare. So that's a great source, right? Health Sector Coordinating Council, yeah.
So Russell, this question might be a little bit from left field, but we often talk about like data minimization in a lot of other fields, right? Like protect the data by simply not ever collecting it in the first place. And when I think about like years past in healthcare, stuff was on paper.
Right.
Is there any minimization or offline options for the healthcare industry anymore, or is that a boat that sailed? Like it's all going to be in the cloud?
John, it's a great topic and a great question. I don't know that it was ever on the table, right? If you think about healthcare has always been about research, been about, historics in terms of, how many people have this and looking at, efficacies across large population bases. And we learn from that statistical data, those trials. And if we don't record those and keep them available, then we can't obviously refer back to them. And so with electronic enablement, access to that data has gotten faster, obviously more easy. With large language models and AI, machine learning, we're able to crunch big data sets, massive data sets now in a blink of an eye, because the computing power has gotten there. And with supercomputers and everything else that's coming in the near term, we're even going to see access to that. So people want to put more and more data online, but the root of this is data management, data access, right? It's an interesting stat. Over 97% of today's breaches that we're seeing do not involve the EMR, the electronic medical record system, right, where we store sensitive data. And in healthcare, data is the gold in your organization. It's what everyone is going after. They're trying to redirect payments, but that's still data, right? They're trying to get identity theft information, that's data. They're trying to get financial records, data. They're trying to get research and new, pharmas, they're trying to get new drug releases and trials. They're trying to get access to that information. It's all data, right? And so if less than 3% of attacks involve an EMR, then we can reasonably assume that is a safe place to keep it. The problem is 97% of those attacks find data unprotected, unstructured. It's like when you walk in the house and you lay your keys next to the front door right? Throw your wallet there, your keys, your credit cards. You go upstairs, go to sleep. Someone kicks in your front door. Thank you. It's right here. I'm glad you left it available for me. You didn't take it upstairs and put it in the safe. You didn't put it in a locked room. You didn't even take it upstairs to another room. You left it laying right by the front door because that's where I'm going to exit in the morning, and I'm going to go right to it. It also allows those thieves to come with the little receivers, pick up your transmitter that's probably next to your front door. Your car's in the driveway, right? And they start your car and drive off with it, right? Because they can transmit that in a reasonable distance. But if that key was on the opposite side, right, they wouldn't be able to do that. And so it's very similar mechanisms that we see repeat itself over and over again. And data management, or we call it data exposure. It's one of the top, 60 elements of a cybersecurity program, and I think it's probably one of the more critical ones. It is one of the hardest things for healthcare to do. Right.
It's so you need to wrap that data in tinfoil so they can't.
Well, I mean, it needs to be encrypted, right? But supercomputing is, the theory right now is our current encryption mechanisms can be broken, and obviously as the computing power becomes, faster and faster and more available, those algorithms to actually break those cryptographic algorithms are going to happen. And right now the assumption is well, you can't break it, in 50 years. Well, what happens when that comes down to 5 minutes? And it will come down, right? And so we'll have to come up with new ways to encrypt, or John, to your point, stop storing it or store it differently, right? Make it non-usable, right? Hash it, encrypt it, so you can still get the analytical value without having the risk or repercussions when it does get breached. Credit card did it through tokenization, right? But the time to live on a credit card is days now, right? I can call it and have it canceled almost immediately. My app just says shut it off, right? I can't do that to my Social Security number. I can't change my name that fast. I can't change my medical conditions, right? And so all of those are being used to exploit the human and extort the human now. They're not only they're going after corporations, but then they take the individual users, find out information about them, and then they go extort the individual. Oh, I heard you've been recently diagnosed with Parkinson's disease. Well, I bet you don't want people to know that. Pay me $1,000 and I won't release it.
It's like the 23andMe, I think, right? When they shut down, and there was a lot of discussion on who are they selling that data to, which is very informative of, potentially future illnesses or things. I mean, there's a lot of precious data in there that somebody could truly exploit against millions and millions of people. It's frightening.
Yeah, absolutely.